are so excited to bring you this live video series to answer any of your questions regarding your oral health, dentistry in general, or how oral care is related to overall health. Here at our office, our goal is to educate patients on what's going on inside their mouth and to help them choose the best care possible. But sometimes, even with our best efforts, we fail to do so. So I thought, let's bring this discussion online and help answer any of those burning questions you may have. And this will help serve our patients and our community at large. I'm excited to do this every week on Friday, and I'm going to ask you guys a great favor and let me know some of those topics that you would like to get answered. Please type in the comments below and we will go over each topic one at a time every week. Okay, before we get started, let me introduce myself. My name is Dr. Manohar. I'm a practicing general dentist in Walnut Creek, California. We are located 317 Lennon Lane, right opposite to Kaiser Shadelands. We are a small family practice treating both kids and adults, and we do everything from cleaning, checkups, x-rays, crowns, fillings, implant restorations, Invisalign, veneers, and other cosmetic procedures. Okay, for today's topic, I chose the most common and the most puzzling question that we get from our patients. Doc, you say I have a cavity, but my tooth does not hurt. It's always a surprise because most of the time when we diagnose cavities, it's asymptomatic. Let's talk how does these cavities actually form? So when you eat or drink anything with lots of sugar, some of this sugar gets left behind in your mouth. The bacteria in your mouth feast on this sugar and produces acid. The acid then starts to attack your teeth and erode the outer layer. I'm going to turn my camera around and show you an X-ray. And this is just a random X-ray from Google. The teeth have an outer strong layer called the enamel. And when the cavity is confined only to the enamel, you will not feel anything. And when it reaches the inner layer of the tooth, the dentin, the much softer layer, you will start to have mild symptoms like tooth becoming sensitive to sweets. That's usually most common first sign. At this point, the tooth is still restorable with the filling. But if you let the cavity go, and when the cavity gets really close to the nerve part of the tooth, that's when it gets tricky. The tooth will start being sensitive to temperature, hot and cold, and more it progresses, it turns into pain. And you will need more additional treatments like root canals and crowns are needed. So what do we do to prevent these cavities from forming? And that's a whole another topic to cover for another day. But in short, finding these cavities at an earlier stage is very important to avoid extensive treatment in the future. That's why x-rays are very important to find these cavities in between the teeth. Regular cleaning and checkups help keep your oral health at an optimum. I want to thank you guys for joining me today. Please let me know if you found this video helpful and give me a thumbs up in the comments below. I would love to see that. If you guys have any questions related to this, please put it in the comments and I will try to answer each and every one of them. Also, if you have any other questions related to dentistry, let us know as well. I will see you guys next Friday with a different topic, and I want to thank you guys for joining me, and I appreciate everyone taking time to watch our videos. I will see you guys next week. Bye-bye for now.